Hi everyone, Dr. Remy from Pain Free and Fit and Posturesize. Today we're going to be going over some of the common mistakes people make while sitting that are actually aggravating their musculoskeletal pains. Neck, back, shoulder, knee pains, hip pains, a lot of them have their origins, believe it or not, in the soft tissue stresses of how many hours you spend every day sitting and how you're sitting. Hope you enjoy these tips. So, in the normal seated posture, ideally, we should have our upper body weight centered on where our leg meets our buttock. That's our ischial tuberosity, or bottom of the pelvic bone. It's right at that crease. To practice that, you could leave your finger there, and as you sit, you can practice tilting forwards and backwards. Most people have a tendency to sit way too far back, and they're actually putting pressure more on their tailbone with their upper body weight as opposed to this crease. So if you train yourself to sit upright, with or without anything behind you to support, I can do that in a good fitting chair or with a pillow behind me, practice first making sure that your upper body weight is centered over that crease. And you can just move back and forth by rocking your upper body back and forth on your hip joint. You want to make sure that the center of your ear, shoulder, and hip are all vertically aligned. Typical mistake with a lot of people is the head moves forward beyond the shoulder. That puts a lot of stress in the neck, aggravating disc conditions, facet problems, muscular strain, tension headaches. Rounding shoulders is another problem. You want to make sure that the front of your shoulder contour is flat, not rounded. That's bringing your shoulders back a little bit. Many people sit with one leg over another. If you sit with one leg over another, you have your favorite side. The side that typically is on top, if you look at the way my hip joint is positioned, externally rotates or turns this leg slightly outwards. If I typically sit with my left leg over my right, either from the knee or from the ankle, you'll notice I'm constantly putting that leg in a position of what we call external rotation at the hip. That's tightening the piriformis and other external rotators of that side. That's a very common problem that leads to piriformis syndromes, hip problems, lower back problems, because what happens mechanically is from sitting so long like this, that leg stays out when you stand, when you walk. That's the cause of why your foot flares out to one side. That also causes the hip to hike up, causes compression in the lower back, the sacroiliacs, the discs, the joints, causes hip flexor tightness, lateral hamstring tightness, weakness on the VMO muscle, which can disturb knee mechanics. There's a whole cascade of kinetic chain events that happen. So ideally, when we're sitting, we would like our thighs to be pointed straight out from us, our knees right over our feet, and the feet pointed straight ahead, avoiding leaning out. Another common problem is people have their feet straight ahead while driving, and then all of a sudden one leg will start leaning out. Again, that's external rotation. It throws the knee out, starts aggravating meniscus problems because of the varus stress that occurs in the knee, creates ankle instability because the ankle starts torquing in an inverted position. You want to make sure that you practice this staying straight ahead. The more you practice proper posture when you're sitting, the more you're going to be taking away those seemingly quiet or innocent activities that are leading to your musculoskeletal pains. I can't tell you how many patients I have come in from the North Shore of Long Island here. We have patients coming from Garden City, Manhasset, Glen Cove, Locust Valley, all the way from Jersey and the city. So many of them have been to so many different doctors and therapists, and they're wondering why their pains aren't going away. They get therapy, they feel better for a while, the pain comes back. They're feeling great, they return to their sports, pain comes back. And when we look at their lifestyles, their posture, the way they move, we find these recurrent movement patterns that have never been addressed, recurrent posture problems that have never been addressed. And being that we spend so much time in the seated position, it's imperative that you start thinking about, how am I sitting? How am I going to hold myself in a better upright position? When you first start changing your posture, remember, it's going to take a lot of muscular effort. Don't try to be perfect at the beginning. Spend some time, maybe 5 to 10 to 15 seconds, maybe 30 seconds trying the new posture, and then forget about it. Set a little timer on your desk, on your smartphone, give you a little chime once every 15 minutes to an hour to remind you, check your posture. The more you practice, the stronger your muscular system becomes, the more your fascial system that's tight starts releasing, and the more normal good posture becomes your way of living. If you like this video and would like to help me help others with this great advice, give me a thumbs up below. Any questions or comments, I'll do my best to get back to you. If you like this kind of advice, would like some exercises to support better posture and the healing exercises for your musculoskeletal pains, I invite you to subscribe to our channel. We've got a lot of great videos on there that'll help you do that. I hope this helps you with your seated posture.